This video is about quarantine. You understand that you were a close contact. You know that you need to quarantine to avoid spreading COVID-19 because you could spread COVID-19 before you develop symptoms, or you could have COVID-19 and never develop symptoms and then be spreading it. So we ask you to stay at home and out of the community for the quarantine period. Quarantine release times are the topic of this video because new guidance came out and we want to explain that to everybody, but also so you understand quarantine release times. If you live with someone who was diagnosed with COVID-19, then you have an exposure. If you're not able to separate out from them, and separating out means using your own bathroom and a separate bedroom. If you don't have a separate bedroom and bathroom for that person who tested positive, then you're continually being exposed. Then you don't get to start counting your quarantine days until they finish their isolation, until they're heading back out into the community because they are no longer infectious. So that's on your last day of exposure is day 0, and then you can count from there for your quarantine period. If you're able to separate out, then you can count your 14 days starting at that point. Now, there are some other options that came out, and that's one of the things we wanted to talk about in this video. 14-day quarantine is still the safest option, but they did come out with new shorter time periods if you're able to meet the requirements. Not working in a congregate setting such as jail, prison, healthcare settings, nursing home, or other settings with vulnerable individuals, you would want to avoid using these quarantine periods for return to work. You could still use the shorter time periods for outside of work, but you need to talk with your employer. There are different requirements for different settings, and they will be able to guide you through returning to work. If you're going to take advantage of these shorter periods, you also need to follow all the guidance for avoiding the spread of COVID-19 disease, including wearing a mask, keeping socially distant from others, meaning 6 feet apart, and avoiding gatherings of people. You're going to need to monitor your symptoms and remain symptom-free for the full 14 days. You're going to need to immediately isolate if you develop symptoms, and that's anytime during the 14-day monitoring period. So here are the options. You start with day 0 here, and you monitor for symptoms. You get tested on day 6 or 7. It could be an antigen test or a PCR test. It doesn't matter as long as you have the test results back. You have no symptoms and that test result is negative, you can be released on day 8. There's an additional 10-day no test option, which means that you could monitor yourself for that full 10 days. If you didn't develop symptoms, you could be released on day 11 and then continue to monitor through day 14 for any symptoms. Should you develop any of those symptoms, and we'll talk about what the symptoms are in just a minute, immediately isolate if you develop symptoms at any time. So the 14 days would be that starting on your day of exposure is day 0. Count the full 14 days. You're released on day 15. The 7-day option requires a test on day 6 or 7. Again, no symptoms, can be released on day 8. The 10-day option, no test required, no symptoms through day 10, can be released on day 11 with monitoring for the 14 days. The symptoms you're monitoring for are listed here. Of course, we're looking for new symptoms. People might have fatigue or diarrhea on a regular basis, but we're looking for that new symptom. And then there's also recommendations for testing. I will put this up. You can read through that. Should you develop symptoms and need testing, then this will give you additional advice. I'm not going to go through all of this, but it is here for you if you need it. If you do not develop symptoms during your 14-day monitoring period, you are released and should continue to remain cautious and avoid close contact with others. If you have any questions, you can call your primary care provider look at the Winnebago County Health Department website where we have a lot of really excellent information. Also, you could check out the state DHS website or the CDC website. If you have additional questions, you can call the health department at 920-232-3000. Thank you and have a great day.